And our new patient, Kevin, is had a virus for the last 5 weeks, you say? Or he thinks it's a virus. We'll see whether it actually is. And this is really of significance because we really need Kevin for the autoimmune part, which we'll do hopefully after lunch. So if you pop down onto your back, Kevin. So what I'm going to do is quickly run through the procedure of finding out where his primary meridians are so that we can actually switch him on and off. All right, what we want to be able to do is switch him from strength to see when we do markers and for weakness. Because when we do this profile, we want to sometimes be working from strength and sometimes from weakness. Should I do this or you get them out ready for me? So we'll just take a rectus femoris, pull the knee to the shoulder. Okay, so we'll pop him straight onto the emotional stress points. Pull, he's nice and strong. So we'll peel him up there. We'll give me the yang ones first. It doesn't matter which one, how you start. It's never going to be the first one, he says, having said it's never going to be the kidney. So the acetates are a really quick way of doing this. They're amazing. And of course these are biophotons, which means that the energy is coming from inside the body, so it doesn't matter about the exterior light. We're not involved with light from outside. So it's none of the yang ones. Remember, the yang ones are the hollow tubes, which Jill's going to talk about, because this is often the home for a lot of chronic infections. So this we're looking for, remember, is the emotion of where Kevin's coming from. Oh yes, lung. That fits, doesn't it? He's had a... Yes. So we pop that one. So you're with me so far with what we're doing. Emotional stress points here don't weaken in the clear, lung does. So now what we're going to do is take that off, and we'll simply pop the lung up on the frontal orbital area there. And we'll go again. So he's in strength. So now we'll go run through the meridians again. Yang ones first, and then we'll see where he weakens to. And this will be the center of his, main center of his attention at the moment. Whoop. You notice I'm tending to put them around the umbilical area, but it doesn't have to be there, but you do get a better response probably off the umbilical area than almost anywhere else. So again, hollow ones seem to be all right. So if you give me the 6 now, yin ones. So remember, he's got an infection. This is the sort of up front. Do you have any other issues sort of further down, deeper or longer standing? Not really, okay. So where would we think, becoming a chronic infection, isn't it? You know, if you've had it for 5 weeks.
The only thing, it started with the loss of my mum as well.
Yeah, so there's a big emotional part there with the loss of mum. Yeah. So I'm putting my money on, what am I going to put my money on this time? I've already lost most of it. I'm going to put my money on the spleen, because the spleen's everything to do with the immune system, isn't it? Hooray. Double or quits.
Yeah.
Okay. So now we've got Kevin in weakness. So whenever we want to see if something is good for him, we can leave that on, okay, and see if it strengthens. And if it's something that's bad for him, we take that off, okay. But we're going to leave that on because we want to talk about his. Did we? By the way, did we get any milk or anything?
Did you bring milk in?
Milk bread? No, I didn't bring it in. Don't worry. At the moment, we'll get it a bit later. Okay. So if we go back now, Gary, in your manuals. No, in your brochure, you'll see a series of handout sheets, and it's this one that we're going to look at.
What's in the forehead now? Lung or spleen?
The lung and spleen on here. So the lung is his emotion, and what we're doing is we're saying where is that motion having an effect, and the answer is on the immune system, okay? So it makes sense there. So what I could do is we could take that off, and let's see what are some muscles, shall we? So the spleen-related muscles, of course, are latissimus dorsi, middle trap, lower trap, and the triceps. So elbow straight, pull into the side. Okay, so that's all right. Push down to the floor, and straighten the elbow. Straighten. Excellent. Okay, elbow straight and pull into the side. No lat at all. Keep it straight. Can everybody see that on the? Do you want to flick it up on the screen? Because when these muscles go weak, they go weak. Okay. There's just nothing there at all. Okay. So push down to the floor. You notice it's only one muscle. Just straighten. It's only one muscle on the meridian, but it's very specific, the muscle-organ relationship. Okay. So if we go to your notes there, you come back, Gary, up onto the slides, if you will. So if you want to test him, first of all, from strength to weakness. He's in weakness now, and I want to go through each of these markers. So this would be the sheet. The company have the website which you can go to. Obviously you have to pay to have the profile done yourself, but the chemicals that they use are common metabolites, as we'll see, of different amino acids and things. I put in here W2S, which means weakness to strength. All right, we're all happy with that. In other words, you're testing a person from weakness to strength to see if they strengthen to it. If they do, they need it. Okay, that means that particular department. So if we tested him with indole 3 propionic acid and he strengthens to it, that means there's an issue with the gastrointestinal fitness. Okay, it means there's an issue with the immune system. It means there's an issue with the cognitive acuity. Okay, so that's how you would work it across. So let's have a look at them in order. So the first one is propionic, indole propionic acid, has been associated with brain, kidney and heart health. It's produced in the human gut exclusively by one particular species of gut bacteria called Clostridium sporogenes from tryptophan, which is an essential amino acid, as you know. And thus, it's a critical marker for healthy gut microbiome. It's considered one of the strongest antioxidants identified. It's been shown to play an important role in brain health, plays a crucial role in maintaining healthy gut, strengthening the tight junctions, etc., etc. So if we put it on, and let's see if he strengthens to it. So then we can tick the box, if you like, on the marker there. No. Okay, so we move on. So indole 3 lactic acid is linked with the formation of downstream metabolites such as the propionic acid. It's again a tryptophan metabolite, and it's a precursor to the propionic. The pathway is heavily involved in the creation of neurotransmitters and antioxidants. So let's see the next one, indole 3 lactic acid. No. Okay, indole 3 acetic acid is a precursor to the other metabolites, in other words, the two that we mentioned. The tryptophan pathway is heavily involved in the creation of neurotransmitters such as serotonin, as you know, and antioxidants that are important in healthy brain and intestinal function. Proper levels help maintain the beneficial lactobacillus species in the gut, which converts sugars into lactic acid. Right, test that one.
Hold the leg. Oh.
So this is something which you probably would pay, I don't know, several $100s, let's say, for, and we can knock it out in 3 or 4 minutes. So tryptophan, we're all familiar with tryptophan as an amino acid. Levels are linked to the ability to fall asleep because it's also the precursor to serotonin, which then goes on to make melatonin, and to muscle health. Tryptophan has been linked to mood and is important for emotional well-being. As you know, serotonin is a brain chemical that brings us up to feeling normal, all right? It's a leveler. Low levels, therefore, make you feel the blues, as it's called, or like depression, but it's a sinking blues feeling. It does not give you a high. It's not a feel-good. And this is wrong to think that serotonin is a feel-good factor. Dopamine is the feel-good factor. When your team wins, it's a surge of dopamine, not serotonin. Serotonin just brings you up to feeling good and level as you should be. So does he strengthen to tryptophan?
Does he strengthen?
So we normally obtain it through the diet, although certain gut bacteria are also capable of making tryptophan.
No.
No. Okay, so serotonin itself now, again, we're testing from weakness to strength. It's linked to the ability to fall asleep, muscle health, brain health, and gut serum. It's serotonin synthesized, facilitated by the adequate presence of vitamin B1, 3, and 6, and folate. It's heavily involved in the creation of neurotransmitters and antioxidants. Okay, so let's see if he strengthens the serotonin.
Hold the leg.
No.
No.
Okay. Right, so we're going to do quinurenic acid, or quinurenirin, is linked with levels of downstream metabolites from vitamin B3. It has been linked with energy levels and gut health. Its production is mediated by B6, selenium, and sulfur. It's used in the production of niacin or B3. It's utilized by the endocrine system to produce certain hormones. So let's see if he shows positive. There's no need to worry about if obviously he doesn't show positive to it.
Hold the leg. Oh, yes.
Yes. So it could be, as we'll see in a minute, this is considered to be mediated by vitamin B6. In other words, to us, that would probably be pyridoxal 5-phosphate. So bearing that in mind, let's just sort of put that in the back of our mind, that possibly this could be an indicator that he needs B6 a little bit later on. Indoxyl sulfate, this is going from strength to weakness, is linked to oxidative stress in numerous cells, including vascular smooth muscle cells, endothelial cells, and bone cells. It's a metabolite of tryptophan and absorbed in the blood by the liver. It's associated with kidney and heart ill health, really, that is. So what we're going to do is test him from strength to weakness. This is a baddie. If you have a build-up of this can compromise the kidney and heart health.
Okay. Hold the leg. Oh, yes, it's weak to that one.
He's weak to that one.
Yeah.
Okay, so let's keep that one. Keep the positive ones to one side there. So we've got another marker. So the more markers, remember what Dr. Goodhart used to say, the more markers you've got, diagnostic parameters, the better it is. Any one is not good enough on its own. And we found this consistently when we were doing these workshops and things, that you could fix all the things that you could possibly think of with the phenotypes, the genotypes, everything you can possibly think about. And then just right at the end, you put the markers on for autoimmune disease and they weaken. And you think, well, how can they weaken to that? What have I missed? Why have I missed something so important as an autoimmune disease when everything seems to muscle test absolutely fine? So there's no one marker, but George always said the bottom line is the muscle. Find what the priority muscle is down the chain, and if that one strengthens, at the end of the day, everything else does. So use all the markers you can. He used to like physiological ones like range of motion. George could stretch a pair of legs out further than anybody could. Pain, you know, he could put his fingers into somebody, into the pain there. Vital capacity meters, oximeters, and so on. So as many physiological tests as you can possibly do. So tyrosine, as we know, is a precursor to dopamine and noradrenaline and adrenaline, which regulates mood, behavior, and general feeling of well-being. So let's see if he strengthens to tyrosine.
This is from weakness?
Yes, from weakness, sorry. So again, we put back on the spleen meridian there.
Hold the leg. No.
She doesn't strengthen, so that's all right. Now we're going to look at the xanthine pathway. When we break down these purine nucleotides of adenosine and guanosine, we go on to make xanthine, which then goes on to uric acid, and then we pass that uric acid down to sodium urate in the urine. So xanthine plays a role in inducing digestive enzymes. So this, in a sense, is a goodie. It's a metabolite, but it's a goodie. Its levels are linked to a good heart rate and heart health. It's a metabolite of the purine ones. It's a mild stimulant and is found in coffee, cola, and green tea. So let's see if he strengthens to xanthine.
Hold the leg. Oh, yes.
Yes, so we've got a third one now. So he's strengthening to xanthine. And then we've got methylxanthine. It's a metabolite of the purine pathway is significant because it affects both the gut and the brain. In the gut, it increases hydrochloric acid and pepsin secretion, which aids digestion. Purines are key component, as you know, of ATP. So just test this one, see whether he strengthens this one.
Hold the leg. No.
No. So we put that one away. And finally, uric acid, which we're all familiar with the name. And this is usually we look for it from weakness to strength to see if a person strengthens uric acid, because it is a very powerful antioxidant. It's a very powerful chemical altogether. But like all chemicals, if it's in excess, it then creates problems. And we're familiar with the big problem, which of course is gout. So this one we would do both ways. So it's the final product of purine metabolism. Metabolites are important because they affect both the gut and brain. In the gut, uric acid increases hydrochloric acid and pepsin secretion. So it's an important component with the digestive system. They're key components of the ATP and cellular signaling. So let's see, first of all, if he strengthens to uric acid, and then we'll test him around the other way to see if he weakens to it. So it's looking as though we got three markers now that we've got from that analysis, which give us a few more markers. But it is a limited test, really, isn't it? And the whole program involves a whole exercise routine as well, physical exercise as well as the biochemistry. But it gives you an insight. But you can see what you pay, I think, for lab tests and these sort of things. And they say tailor-making it. We tailor-make, don't we? We really tailor-make nutrition to our patients, much, much more than most of these so-called tailor-making factories and laboratories can ever do.